Pelvic hemorrhage is hidden, massive and lethal. A patient can bleed more than 2 to 3 liters internally without obvious external signs. Always treat pelvic bleeding as life-threatening until proven otherwise. Suspect pelvic bleeding in cases of high-energy trauma, or when you see unexplained shock without another clear source. Never underestimate pelvic injuries. Start with the ATLS ABCDE sequence. See previous video. Get wide-bore IV access 14 or 16 gauge. Begin IV fluids immediately. Send blood for CBC, grouping and crossmatch, coagulation profile, and ABGs with lactate. But remember, do not wait for reports to resuscitate. Apply a pelvic binder early. And arrange blood products. Avoid excessive crystalloids. Use packed red cells early. Replace blood for blood. Then add plasma and platelets. Aim for permissive hypotension until bleeding is controlled, except in head injury, where adequate cerebral perfusion must be maintained. Activate the massive transfusion protocol if there is persistent hypotension or ongoing blood loss. The standard ratio of packed red blood cells, plasma, and platelets is 1:1:1. Practically, this means 4 units of packed red cells, 4 units of fresh frozen plasma, and 1 adult dose of platelets. Perform a FAST scan to rule out intraperitoneal bleeding. But remember, FAST may be negative in pelvic bleeding, so a negative FAST does not exclude pelvic hemorrhage. If the patient is unstable, continue fluid resuscitation. Keep the pelvic binder in place, transfuse blood products, and proceed quickly to definitive bleed control. If the patient is stable, perform a CT scan with contrast. Identify arterial blush and define the pelvic fracture pattern. This will guide definitive management. Definitive management options include angioembolization, preferred for arterial bleeding, preperitoneal pelvic packing, external fixation of the pelvis, and, as a last resort, internal iliac artery ligation. Monitor continuously. Check vitals, urine output, aim for more than 0.5 milliliters per kilogram per hour. Serial lactate and hemoglobin levels. Pelvic hemorrhage requires repeated reassessment, never assume it is controlled. Key points to take home. Pelvic bleeding is concealed and lethal. Always follow the ABCDE sequence strictly. Control bleeding early. And remember, blood is more important than fluids in resuscitation. Thank you for learning with me. Follow for more. And for detailed explanations, step-by-step breakdowns, and more engaging medical education videos, don't forget to subscribe to my YouTube channel.